And at this time, I believe we are joined online by the Director of Animal Care Services, Amy Campbell, should you have any questions.
Can I interrupt for a moment? It appears that YouTube is not working.
Denise, are we waiting for something?
I'm waiting for a response. It is working now.
Is there any members of the public that wish to speak on item 6B? Commissioner, do you have any questions?
I only have one. So it was supposed to remove the spay and neuter responsibilities, is that correct? Or are they still dealing with the spay and neuter?
I'm sorry, we cannot hear you.
So the one question is under the bulleted examples of duties, it says monitors productivity and effectiveness of the spay and neuter and adoption programs, when in your introduction you said it was to get rid of the spay and neuter since they don't deal with that portion anymore.
I would like to defer to Amy Campbell if she is on the line.
She is not.
She is not. Okay, I will have to ask a request to postpone the vote on this until I can work with the Animal Services Director.
Shall we move on?
How about if you give us a minute and I'll see if I can get her online.
Okay. Clock's ticking.
It's just that one bullet, third to the last.
Well,
It still mentions.
under the background and analysis,
If I may, through the chair, I do know that they do spay and neuter, but the purpose of this particular classification is to remove that they are the coordinator of spay and neuter. But I still would like the Director of Animal Care to.
Because it's in that, only in that bullet point where spay and neuter is mentioned again. So is the goal to completely, are they not dealing with spay and neuter at all?
Correct. That's why I would like to hear from the Animal Services.
It's the
And
wrong
spay and
link.
neuter.
Messed up on the.
Yeah,
So I
of the
just sent-
spay and neuter.
Yeah, so that was red line,
Yeah.
rid of that. But then they added it in the blue.
Okay, we got her.
She on?
Yep.
So CC, you want to ask that question? Who's on, actually?
Is she there?
Amy
If I may,
Campbell
through the
is on.
chair, we are now joined by Amy Campbell, Director of Animal Care. Amy, if you could please, Commissioner Winiger does have a question regarding one of the examples of duties and responsibilities. Towards the end, we have monitors productivity and effectiveness of the spay and neuter and adoption program. And the question that Ms. Winiger has, if you could please restate your question for Amy.
Because in the background, it was explained that they were not dealing with the spay and neuter program anymore, so that's why we were changing the classification. But then in this bullet point, it says to monitor the effectiveness of the spay and neuter program. But that's the only, and it's a blue line one, not a red line. So are they still dealing with that? Is that in error?
So they are no longer scheduling spay or neuter for the caravan in the clinic, but they still monitor spay and neutering for sheltered animals and animals who get adopted, so they don't leave until they're spay or neutered. So they do put, and they're monitoring spay and neutering for sheltered animals, not for the clinic or caravan.
That answer your question?
Yeah,
Does that answer the question?
yeah.
Yeah.
Okay.
Commissioners, any other questions? Anybody from the public? We already, I think, went down that.
Yep.
Can I get a motion?
I'll make a motion to approve the classification specification modification and title change, spay and neuter adoption coordinator to adoption program coordinator.
I'll second.
I got a motion and a second to approve item 6B as classification, specification, modification, and title change for spay, neuter, adoption coordinator to adoption program coordinator. Roll call.
Commissioner Ebbium,
Yes?
Commissioner Wiley,
Yes.
Commissioner Slater,
Aye.
Commissioner Winiger.
Aye.
Motion carries unanimously.
Item 6C is classification, specification, modifications for substance abuse counselor 1, substance abuse counselor 2, senior substance abuse counselor, substance abuse treatment supervisor, substance abuse program and service manager, and deputy director of substance abuse disorder treatment, human services.
Good morning, Commissioners. Brandy Dalzell, HR Manager. At the request of the Behavioral Health and Recovery Services Department, the Substance Use Disorder Treatment, or SUDT, classification series has been revised. Most changes throughout the Substance Abuse Counselor 1, Substance Abuse Counselor 2, Senior Substance Abuse Counselor, Substance Abuse Treatment Supervisor, Substance Abuse Program and Services Manager, and the Deputy Director of Substance Abuse Disorder Treatment focus on modernizing the language for clarity and updating the knowledge, skills, and abilities to reflect the current professional terminology. The most significant updates apply to the Substance Abuse Counselor 1, Substance Abuse Counselor 2, and the Senior Substance Abuse Counselor classifications, including revised minimum qualifications to ensure compliance with California Code of Regulations, Chapter 8, Certification of Alcohol and Other Drug Counselors, and to clearly communicate requirements for accurate applicant screening. And at this time, we are joined by Dr. Janine Miller, Director of Health Services. Should you have any questions?
Commissioners, any questions?
No.
Are there any members of the public that wish to speak on item 6C? Can I get a motion?
Okay, I'll make a motion to approve the classification, specification modifications for substance abuse counselors 1 and 2, senior substance abuse counselor, substance abuse treatment supervisor, substance abuse program and services manager. Lastly, the deputy director, substance disorder.
I'll second the motion.
I got a motion and a second for item 6C. Classification, specification, modifications for substance abuse counselor 1, substance abuse counselor 2, senior substance abuse counselor, substance abuse treatment supervisor, Director of Substance. Clerk, can I get a roll call?
Commissioner Wiley,
Aye.
Commissioner Slater,
Aye.
Commissioner Winiger,
Aye.
Commissioner Ebbium.
Yes.
Motion carries unanimously.
Item 6D, new classification and reclassification of incumbents for crisis intervention specialist and supervising crisis intervention specialist. Classification, specification, modification for mental health rehabilitation specialist. Human Resources will.
Good morning, Commissioners. Giovanna Arguelles, HR Analyst. The item before you, Crisis Intervention Specialist, Supervising Crisis Intervention Specialist. At the request of the Department, Human Resources has created 2 new classifications due to increased crisis response capacity, improve response times, and provide consistent and high-quality intervention for individuals in need. These positions are mandated and will provide 24/7 crisis response in lieu of law enforcement for mental health-related calls. As part of this effort, 2 current incumbents will be reclassified into the newly established classification of crisis intervention specialists. Additionally, we have made modifications to mental health rehabilitation specialists specification to incorporate revised language and clearly defined the duties and responsibilities for the work performed. I am joined by Dr. Janine Miller, Director of Health Services, as our subject matter expert, should you have any questions at this time.
I have a question. These are new, sounds like they're new positions in the sense that the old positions are, people in the current positions are being moved into these positions. Can you just clarify?
Sure. So we didn't have crisis worker positions. We, as some of you may know, we outsourced services in 2013. And with that, our crisis services were also outsourced. And at that time, crisis was a combination of clinicians that when the county ran it, clinicians and a rehab specialist that would kind of consult with clinicians. And in January of 2025, kind of rolled out in 2024, the state of California made it a mandate that every county offer 24/7 crisis response, mobile crisis response. And with that, over the last several years, the county has taken on more in-house services. And so not everything has been contracted out like it did in 2013. And crisis was one of the things, the mobile crisis response was something that the county took on in-house. And one of that was that really making sure that we were really paying people for the job they were doing as crisis workers versus mental health rehab specialists versus clinicians. And so we really worked to create a crisis-specific position that really details with what they're doing, going out in the field, responding with law enforcement at time, not responding with law enforcement at time, and making a difference between those that don't, who may hold 5150 privilege, but don't have to actually go out on crisis calls, and those that have to go out on crisis calls. So this is kind of in line with the new state mandate and really opening up that mobile crisis response and kind of bringing that service back into the county.
So does it involve hiring new people?
It involves hiring new people, and then we have some people who are in a mental health rehab specialist classification that have been doing some of that work, but we really feel that they should be paid adequately for the work they're doing and in a job that really clarifies what they're doing and what their needs are. So it is every employee that was in the mental health rehab specialist was offered that we currently have. If you had a choice between mobile outreach, which is more of a mental health rehab services, or crisis, what would your priority be, or where would you see yourself? And those that wanted to go crisis will be reclassified in that crisis classification.
And the new people being hired are because you had jobs outsourced before.
Correct. And
If I may, through the chair, I'm just going to interject really quickly. I just want to remind the commissions, we don't necessarily deal with salary of individuals, incumbents, and classifications. The work does require higher skill level and requires 24/7 on-call abilities. So there is.
We didn't ask a question.
I thought that was the question. I apologize.
What's that?
I said, I thought that was your question. I apologize.
No, my question was, I think Sherry's question was hiring new people, and my comment was the reason for that is because you had to outsource some of this.
Because we didn't have crisis workers in-house, and when we took on the mobile crisis response duties, we then had to be able to provide 24/7 crisis. We've kind of split that with one of our providers doing the after hours, but we still have to be able to staff it, the hours that we are providing crisis services, and we don't have enough staff, so we're needing to hire also.
Thank you. No salary question in there.
And this was state mandated?
Yeah, so the state, which might actually change, but we would still do mobile crisis. So yeah, the state put a mandate to really move. It's been an effective model to reduce law enforcement response. A lot of people believe that if you're in a mental health crisis, you should be served by a mental health worker and not law enforcement. So there was a lot of movement to move to having mobile response units, and across the United States. In different states and different counties, they have had mobile response units. City of Berkeley, San Francisco has had mobile crisis and response for years. I actually worked on the city, San Francisco's mobile crisis and response. And so it's been an effective model. And so the state really went as an evidence base to really change that response to be mental health workers responding or with law enforcement in situations where there could be danger. We would respond with law enforcement. So in each, there's actually called Crisis International. It's a whole organization that works with law enforcement and mental health to have better responses to mental health crisis. So yeah, the state made it a mandate across all counties in California to offer mobile crisis 24/7.
Any other questions? Is there anyone in the public want to make a comment on this?
Seeing none in the room or online.
Can I get a motion?
Okay, I'll make the motion to accept the new classification, reclassification of incumbent crisis intervention specialist and supervisor crisis intervention specialist, classification, specification, modification for mental health rehabilitation specialist. And thank you for your work.
I'll second.
It has been moved and second that item 6D, new classification and new classifications and reclassification of incumbents for crisis intervention specialist and supervising crisis intervention specialist, classification, specification, modification for mental health rehabilitation specialist. Clerk, can I get a roll call?
Commissioner Slater?
Aye.
Commissioner Winiger?
Aye.
Commissioner Ebbium?
Yes?
Commissioner Wiley?
Aye.
Motion carries unanimously.
Item 6E is new classifications, reclassifications of incumbents for client services representative, integrated service coordinator 1, integrated service coordinator 2, and senior integrated service coordinator, and abolish of classifications of community health worker 1, community health worker 2, senior community health worker, health program eligibility worker 1, health program eligibility worker 2, and senior health program eligibility worker. Human Resources will present.
Good morning, Commissioners. Brandy Dalzell, Human Resources Manager. The item before you recommends approval of new classifications, Client Services Representative and the Integrated Services Coordinator 1, Integrated Services Coordinator 2, and the Senior Integrated Services Coordinator, as well as the reclassification of 14 incumbents into these roles, along with the abolishment of the Community Health Services Worker Series and Health Program Eligibility Worker Series as stated previously. These recommendations stem from Senate Bill 525, which establishes minimum wage requirements for healthcare workers, which is defined in the bill, and their salary. While salary is not within the purview of the Commission, approval of classification changes is needed. The proposed classifications align with Senate Bill 525. The requirements more accurately reflect the healthcare support and the client-facing work performed within the public health and behavioral health programs. And again, at this time, we are joined by Dr. Jenny Miller, Director of Health Services, should you have questions.
So my understanding in a nutshell is this is driven by the Senate Bill 525, but in order for current workers to be paid at their appropriate pay level, these reclassifications have. Am I understanding this correctly?
If I may, through the chair, yes. The glitch is salary, right? However, our class specs that we're presenting to you now more accurately reflect the wording and description of what a healthcare worker is. And so we took analysis of our current classifications of all of our employees within the behavioral health services and mental health, public health, and we had to evaluate each of the job descriptions, if you will, and with the help of the departments and Director of Health Services, we were able to delineate who needed what and improve their classification descriptions.
Any other questions? Are there any members of the public who wish to speak on item 6E?
Seeing none in the room or online?
Can I get a motion?
I'll make a motion to improve the new classifications, reclassifications of incumbents, client services representative, integrated services coordinator 1, integrated services coordinator 2, and senior integrated services coordinator, and the abolishment of classifications community health worker 1, community health worker 2, senior community health worker, health program eligibility worker 1, health program eligibility worker 2, and senior health program eligibility worker.
And I'll second.
It has been moved and seconded that item 6A, new classifications, reclassifications of incumbents for client services representative, integrated service coordinator 1, integrated service coordinator 2, and senior integrated service coordinator, and abolish the classifications of community health worker 1, community health worker 2, senior community health worker, health program eligibility worker 1, health program eligibility worker 2, and senior health program eligibility worker. Clerk, can I get a roll call?
Commissioner Winiger?
Aye.
Commissioner Ebbium?
Yes,
Commissioner Wiley?
Aye.
Commissioner Slater?
Aye.
Motion carries unanimously.
Item 6F is new classifications for payroll analyst 1, payroll analyst 2, senior payroll analyst, and reclassification of incumbent. Human Resources will present.
I'm Jennifer Cheek-Payan, Human Resources Analyst 2. Human Resources recently completed a classification study of the positions assigned to the County Payroll Division, which at one time operated in the Auditor Controller's Office, but was reassigned to be managed under the Executive Office a couple of years ago. Our review of the position description questionnaires, departmental documentation, and discussions with management confirm that the existing accountant auditor specifications do not accurately describe the specialized countywide payroll administration work being performed. To address this, Human Resources is proposing 3 new classifications: Payroll Analyst 1, Payroll Analyst 2, and Senior Payroll Analyst. This series creates a clear progression from entry through senior level and better reflects the technological skills, technical knowledge, skills, and abilities needed to administer complex payroll functions, including compliance with multiple MOUs, retirement benefits, and payroll-related accounting. The new specifications distinguish these positions from traditional accounting roles in the auditor controller's office by focusing on countywide payroll processing, reconciliation of payroll transactions, and payroll-specific general ledger work. And they support a consistent structure for future recruitment and advancement in this critical function. This morning, Human Resources is requesting that the Commission approve these 3 new classification specifications for Payroll Analyst 1, Payroll Analyst 2, and Senior Payroll Analyst as presented or as modified by the Commission. In addition, based on the study's findings and the level and complexity of work currently assigned, Human Resources recommends reclassifying one incumbent from Accountant Auditor 2 to Senior Payroll Analyst. This action will align the incumbent's classification with the actual duties performed within the Executive Office's payroll division. I would also like to acknowledge the presence of Tony Rakes, Deputy CEO, and we welcome any input or questions that the Commission may have regarding these recommendations.
I have 2 questions. Reclassifying the incumbent from Accountant Auditor 2, Senior Payroll Analyst, does that eliminate that position or just keeps it unfilled? What happens to that? That's my first question. What happens to that position?
Good morning, Chair. Good morning, Commissioners. Tony Rakes, Deputy CEO. And HR, feel free to chime in on this if I misstep. But as far as the prior position, the Accountant Auditor 2, that will remain because there are others that fill that classification outside of payroll.
Outside of payroll?
Yeah.
Commissioners, if I may, one of the primary purposes of this reclassification recommendation is because these roles used to be filled through the Auditor Controller's office. However, they got transferred to the Executive Office, and they strictly do payroll functions now. They don't do anything related to what the Auditor Controller's office does.
So when you say there are other Accountant Auditor 2 positions, this is specifically the position related to payroll, though. So should it designate that in the language, that to reclassify the incumbent from the Accountant Auditor 2 payroll, something that tells us it's payroll person that's being reclassified to the senior?
That person was never specified as being strictly a payroll person when they were in the auditor's office. Okay. It evolved. So once the people doing payroll at the time transferred over to the Executive Office, the auditor's office no longer had anything to do with payroll. And as the couple of years have progressed that they've been with the Executive Office, it became clear that there was a need to separate them completely from the Auditor Controller's office, since they have nothing to do with that anymore.
So how do we know which Accountant Auditor 2 is being reclassified then? One of them.
If I may, through the chair, that's a good question, and I appreciate that. The incumbent may or may not be online. I don't know if she is joining us. She has been notified. We have worked with her through the PDQ, the Position Description Questionnaire, and over the months we have worked with her. So in the event such as this, any incumbent that is reclassified, they are well aware of their particular position within their team and what is happening. So in this event, we are looking at the payroll division. So we are looking at the payroll classifications. The person or incumbent that is currently classified as an Accountant Auditor 2 has worked with us, and we've worked with them. They're aware of their proposed new classification of a senior payroll analyst. And so it is just that one incumbent. And it gets notified and later throughout. and it's based on a position number, so pending approval from the commission, it then too also will go to the Board of Supervisors for approval of the position allocation number, the position number to change, and that will change the classification title that is designated to that individual.
They don't have to deal with the position number here.
No.
So it's literally affecting one.
In this instance, yes,
And they've been fully
But
aware,
moving forward,
absolutely.
and they've been part of the study.
Absolutely. And again, if Ms. Dang is on the online, she can speak to it if she so desires, but I don't believe she is.
And it wasn't necessarily necessary to include the incumbent's name in this.
They never
It is
do.
standard procedure that we typically don't include the name
Yeah.
in the public documents.
Okay, so then my other question about the new classification specifications. So those are, who did those positions, who did that work currently? Who does that work?
If I may, through the chair, that work that's being done, that will be done by the payroll analysts and senior payroll analyst, have been done by the payroll division by the incumbent, the payroll manager, and then another staff within the payroll division. So all those payroll responsibilities are currently being performed by the staff within the payroll division.
And this proposes them to be performed by payroll staff in the executive office? Not following this.
Good morning, Commissioners. They've been doing the work, but these employees started out in the auditor controller's office. They've been doing that work. Then the Board of Supervisors decided that those positions that were doing payroll should be under management of the executive office as opposed to the auditor's office. I don't know the reason. I would guess it was probably oversight because you don't want the audit, but that's neither here nor there. So these people were doing those payroll duties. They got moved to a different department. They continued to do the same job under their original classifications, but they're not classified correctly because now they are specializing strictly only in payroll. They're no longer associated with any other auditor controller duties. So we needed to strip anything that referenced the auditor's office out of those class specifications and make sure that the class specifications were specific to the fact that these people only deal with payroll-related items, nothing related to the auditor's office.
So if they're not part of the auditor controller office anymore.
Right. They used to be, but not anymore.
Right, and so now they are part of the executive office?
They're in the payroll division, which is
Okay.
managed by the executive office.
Okay.
Yeah.
Okay.
Yep. Thank you.
Do we have any other questions? Are there any members of the public that wish to speak on item 6F?
Seeing none in the room or online.
Can I get a motion?
I'll make a motion to new classification, reclassification of incumbent payroll analyst 1, payroll analyst 2, and senior payroll analyst.
Can I get a second?
I'll second.
It's been moved and seconded that item 6F, new classifications for payroll analyst 1, payroll analyst 2, senior payroll analyst, and reclassification. Clerk, can I get a roll call?
Commissioner Ebiam,
Yes?
Commissioner Wiley,
Aye.
Commissioner Slater, Commissioner Winiger.
Aye.
Motion carries unanimously.
Item 8 is to be used for human resources to provide information to the commission regarding human resources topics. That one good.
Oh, okay.
Do we have anything to present from human resources?
Good morning, Denise Bartlemay, Assistant HR Director. Did you skip 7? Other business?
Shows none. Should I skip that?
Yeah, just the announcing.
Huh?
Just the announcing.
Do I have to announce that there's no other business?
Yes.
I'll make an announcement on other business, there's none. You want me to follow up on agenda item A?
No, that's okay.
Okay.
So, good morning, Denise Bartlemy, Assistant HR Director. We've included a report of HR topics, and we'll continue to give you the same report for moving here forward. So if you have any questions, I can answer those at this time.
Any questions, Commissioner?
Well, I do, but I don't think it's more related to what we just approved in 6G. And I don't know if HR has any connection to that.
Skipped.
What's that?
Not understanding the
Oh, we
question.
skipped 6.
I don't mean 6G, I meant 6F.
Oh, okay.
Yeah.
And a question.
Yeah. well,
So I guess I just want clarification, even though we already approved it. Those positions, payroll analyst 1, 2, and senior payroll analyst, those were, since the auditor controller office essentially was merged with treasurer tax collector, those positions were removed from the auditor controller purview and reassigned to the executive office. Is that right?
Denise Bartlemy, Assistant HR Director. Yes, but it didn't have anything to do with the merging. You know, it's not,
No.
it's
Oh.
not just because of the merging, but, so I don't understand the relevance, I
Okay.
guess.
It didn't have to
Of the
do with the
question.
merging of the auditor controller, treasurer tax collector merging?
I would say no, but I don't think it's
Okay.
relevant to the change, because the way the changes were done was the staff was moved into the executive office, and their titles no longer fit, and the job descriptions no longer fit.
Okay.
So then new classifications were created to show what those
Okay.
employees now actually
And when
do.
were those positions moved into the executive?
I couldn't tell you an exact date. It's been over a year, I would say.
Okay. Thank you. So this wasn't about anything involved with the movement, just about getting the positions clarified.
For the work they're actually
For the
doing.
work they're doing, yeah.
Yep.
Thank you.
Any other questions? With no other business today, the meeting adjourns at 10:19 a.m. Thank you.
Later, Kevin. I don't think these were on. Oh, no, it is.
You have to have a
Yeah,